Hopkins and government health officials now saying that there have been more COVID deaths in the year 2021 than the previous year, 2020. Joining us now to discuss, Dr. Evan Levine, cardiologist, author of the book on your screen, Your Doctor Won't or Can't Tell You. Doctor, thank you for joining us. Some sad news to report. As we said, the U.S. COVID-19 death count for 2021 has surpassed the number in 2020. Johns Hopkins reporting that the total of U.S. COVID death count, 770,800 total. And then in 2020, we saw 385,343 and more in 2021, 385,457. Unfortunately, we're not at the end of the year yet for 2021, so perhaps the number will increase. But this time we have therapeutics in place. We have 3 vaccines, and anyone ages 5 and up now can get it, plus those booster shots, which just got approved as well. Why do you think we still see this number increase?
I think there are a number of reasons. Number one, let's not forget the epidemic began in April. There were hot spots during the year. Now, the entire country is a hot spot. But what I suggest is that we would have had 4 million dead without that vaccine. Let's look at the country like Romania. They don't vaccinate. They only have about 30 to 35% of their population vaccinated. They have very few urban areas, but they have a 7-fold higher rate of death according to per population than the United States, 7 times. So what I'm saying is that these numbers would have been in the Holocaust numbers if we didn't vaccinate. Sure, the numbers are high, but they would have been much, much higher.
And we've seen millions of Americans choose to get the vaccine, again, to protect themselves, either get that first dose or now, of course, at this point, you've got people with both doses and even some with a booster shot as well. I'll ask you also about the decision to get that booster shot. A lot of people now reaching that 6th month since their second dose here. Here's what Dr. Fauci had to say about what it might mean to be fully vaccinated. Take a look at this.
Vaccine efficacy wanes over several months. It's still a very, very effective vaccine. But as we've seen from studies in Israel, most recently from the UK, when you boost an individual with a 3rd shot who has had an mRNA boost, that you dramatically increase the protection against infection, against hospitalization, and in the Israeli study, even against death. So there's no doubt about it. The data are very clear.
Again, speaking in favor of vaccine booster shots, do you think that it's sort of blanket advice? Should it be a case by case if you're deciding whether or not to get boosted? What would you recommend, doctor?
Well, as a healthcare worker, I am boosted. I think the boost really diminishes the risk of infection. That's the big thing. As far as hospitalization, at 6 months, there was still a 93% reduction in hospitalization. I think, ironically, the boosters actually protect the unvaccinated, because if there is less of a herd of people who are infected, the biggest benefit may be for those who are unvaccinated. My suggestion is anyone at risk, any healthcare worker, should get the booster. Perhaps those who are infected and were vaccinated, perhaps they should not consider getting a booster, or anyone who had a significant adverse effect would like to have that discussion with their physician before getting boosted.
Yeah. You know, we've spoken with other medical professionals on this program, and they say maybe even check out those antibody levels as well before you consider getting a booster shot, especially if you've had natural immunity, just to check in and see where those numbers lie. And if we could check in realistically before we head off for Thanksgiving vacation. I know a lot of people will be traveling more often this year. Again, you've got more vaccines in play, so that should protect more people, ideally here, as you make your way through the airports and back home for the holidays. What's your recommendations for those who are ready to see their families this Thanksgiving?
Well, I'll just give you an example. I was just at a swim meet in a large auditorium, and vaccines were not mandated, but wearing a mask was. But nobody really paid attention to the mandate, so I decided to count how many folks were wearing masks. Out of 100, 8 had no masks, 20 were wearing it below their nose. I'd like to know if I see my relatives and I'm in very close contact with them if we're all vaccinated. Again, I believe in the science. I believe everyone should be vaccinated. If you're not vaccinated, you should at least let your family know, I am not vaccinated. Perhaps at least get a COVID test prior.
All right. Dr. Evan Levine, thank you very much for joining us. Happy
You're
Thanksgiving
welcome,
to you.
Emma. Thank you, Emma. You as well.
Thank you.
All right, still ahead, we continue